I'm Garvin Lynch, and this is Lynch's Pharmacy Health Information video series. This video is on headache. So, in terms of treating a headache, the first step is to pinpoint anything that might be causing it and obviously remove this. A good way to do this might be to keep a diary. Keep a diary of what you eat, what you drink, or you do, and then record every time you get a headache and see if you can identify anything that might have caused a headache. Use this diary to avoid those trigger factors in the future. In terms of drugs, then paracetamol, aspirin and ibuprofen, they all have pretty similar pain-killing abilities. The paracetamol, however, lacks the anti-inflammatory effect that the aspirin and ibuprofen have. The aspirin and ibuprofen are both called non-steroidal anti-inflammatory drugs, or NSAIDs for short, and are very good at reducing inflammation as well as pain-killing. The paracetamol is just pain-killing. For paracetamol, there are various ranges of Panadol. For aspirin, Anadin and Dispirin are two of the best known products, and ibuprofen, then it's Nurofen or Buplex. Paracetamol is a good choice when you can't use the aspirin or the NSAIDs, as the aspirin can only be used in over 16 years of age. It can't be used if you're pregnant, obviously. It can't be used if you have a history of stomach problems. That goes for all of the NSAIDs. It's very rough on the lining of the stomach, and certainly if you're an asthmatic, you shouldn't really use the NSAIDs either. So paracetamol is a good alternative in all those cases. So as I've said, the NSAIDs are very good for inflammation, particularly any musculoskeletal pain or headache due to musculoskeletal pain like dental pain. The aspirin and Nurofen would be excellent. It's important to note with the aspirin not to take if the patient is taking anticoagulant medication. So in any medication to thin the blood, like warfarin, or if they're already taking aspirin as part of a prescription, obviously don't give them any more aspirin. Similarly, if taking the Panadol, don't take with other paracetamol containing products. So the Dispirin, the Anadin and the Nurofen are all good examples of NSAIDs. The soluble products tend to be less irritant on the stomach and cause less stomach problems. So the Dispirin Original and the 500 milligram ones can be dissolved in water, and they tend to be easier to take than the chewable ones or the tablets. The Nurofen is ibuprofen and is much newer than the aspirin is, and generally causes less stomach problems as well, and the usual rules apply. Don't take if you're asthmatic or have a history of stomach problems. If the headache is due to congestion or sinus pain, the congestants might be enough to treat it if there are a few. There are a few: Sudafed, Actifed and Sinutab. They all contain the same decongestant called pseudoephedrine. Now, congestion is caused by dilation of the vessels in the nasal passage and in the sinuses. What pseudoephedrine and other decongestants do is they shrink those vessels. They constrict them and shrink them back to size, which is great at relieving congestion, but it has side effects of possibly raising the blood pressure. So anytime you're offering anyone a product with pseudoephedrine in it or other decongestants, always ask the patient if they have any history of hypertension or are taking blood pressure medicine. If so, just avoid them altogether and try something else. So always remember with the decongestants, they are on blood pressure medication. Sudafed is just a pure pseudoephedrine decongestant. Actifed is pseudoephedrine with an antihistamine in it, so it's very good if they have a runny nose as well. And Sinutab is pseudoephedrine with paracetamol in it, so it's good if they have a headache or maybe a bit of temperature as well. The Sudafed and Actifed are for over 12s only, and the Sinutab can be used from 6 years of age and up. So these are the simple painkillers: paracetamol, aspirin, ibuprofen, decongestants. Then you've combination products, which are the most part are either paracetamol and codeine or ibuprofen and codeine. The important thing about these is that they should only be used once one of the single ingredient products has failed. So the likes of Nurofen Plus, which is ibuprofen and codeine, and Sindol and Solpadeine are both paracetamol and codeine. It's arguable whether the amount of codeine in them is actually enough to produce a pain-killing effect. It may not be, it may have a placebo effect. As I've said, it's very important only to use these after one of the others has failed. The reason being that the inappropriate use of them can lead to medication overuse in headache, even addiction. Medication overuse headache is basically where somebody takes, let's say, Solpadeine for a headache. They might take it for a little too long, or they might take it a bit too much of it. So when they stop taking Solpadeine, they get another headache, simply from withdrawal of the codeine which is in it. So because they get this headache, they go back on Solpadeine and get caught up in a vicious cycle of taking medication for a headache which is actually being caused by the medication. So it's important to keep an eye out for this in patients, as well as for unfortunate situations where some patients actually can become addicted to codeine, in the likes of Solpadeine and Nurofen Plus. The Migrelieve are specifically aimed at treating migraines. There's two different products. The yellow tablets have paracetamol and codeine in them, and the pink tablets have paracetamol, codeine and an antihistamine, which is to treat nausea. So if they're feeling quite sick with the migraine, the pink one might be the way to go. There's also a product with both the yellow and pink tablets contained within the same pack. So they are most of the products available. So when somebody has a headache, just to treat it in a stepwise approach. So if they need medication, the simple way to start would be a paracetamol, aspirin or ibuprofen. And if it's congestion or sinus related, you try a decongestant. And perhaps if that fails, you go on one of the combination products, and counsel would be needed for short-term use only. And keep an eye out, don't overuse any medication for headache. If you have any questions on headaches, you can contact me through the live pharmacist on the website, email me, or call into the pharmacy in Broaddale up Maryborough Hill. Thank you for watching.